Imagine a world where a mother's lullaby is just a gentle vibration, where laughter is seen but not heard, and hello never quite arrives. For some children, this is reality from the very beginning, a world of profound silence. It's not a world of sadness, but of difference, where connection is built through sight and touch, and a smile speaks volumes. Often the signs are subtle. A baby who sleeps through loud noises, who seems calm and content, but is simply untouched by sound. The world's noise continues, but for these children, it's always just out of reach. Usual milestones, turning to a voice, babbling, may not appear as expected. These children become masters of observation, reading faces and gestures, but miss out on the effortless absorption of language through hearing. This silence is not the end, but a beginning, a call to action for parents, families, and professionals. Recognizing this quiet world is the first step to opening the door to sound and connection. By staying vigilant and compassionate, we can help every child take their first steps from silence into a world of sound. Childhood hearing loss means a child can't hear sounds as well as others. It's not all or nothing, but a spectrum. Some children miss only soft whispers, others hear nothing at all. Hearing loss can be congenital, from birth, or acquired, develops later, and can affect different parts of the ear. Conductive loss involves the outer or middle ear and is sometimes temporary. Sensorineural loss affects the inner ear or nerve and is usually permanent. Some children have a mix of both. Importantly, hearing loss is not a reflection of intelligence or potential. It's a physical condition, like needing glasses. With the right support, every child can thrive and reach their full potential. Understanding the basics helps us move from fear to empowerment. Early detection of hearing loss is life-changing. The first years are critical for brain and language development. Babies' brains soak up sounds and words, building the foundation for communication. Without sound, this process is disrupted, leading to delays in speech, reading, and social skills. Early detection allows us to intervene, giving the brain the stimulation it needs. Hearing connects us to others. Without it, children can feel isolated or left out. Identifying hearing loss within the first months and starting support right away makes all the difference. It opens the world of sound when the brain is most ready to learn. Early action helps children develop language, succeed in school, and build friendships. It's not just about hearing, it's about giving every child the best possible start. Early detection is a lifelong gift of connection. Childhood hearing loss has many causes, both genetic and environmental. About half of congenital cases are inherited, sometimes from parents who hear normally but carry a gene. Other causes include infections during pregnancy, birth complications, or prematurity. After birth, common causes include glue ear, fluid in the middle ear, serious illnesses like meningitis or head injuries. Exposure to loud noise and certain medications can also damage hearing. Knowing these risks helps parents and doctors stay alert and protect children's hearing health. Awareness is key to early action. Newborn hearing screening is a quick, painless check offered to all babies, usually before leaving the hospital. It doesn't diagnose hearing loss, but identifies babies who need further testing. Two main tests are used: the AOAE test, which checks for an echo from the inner ear, and the AABR test, which measures the brain's response to sound. Both are safe and comfortable, often done while the baby sleeps. Sometimes babies don't pass the first test due to fluid or movement. This doesn't mean hearing loss, just that the test will be repeated. If results are still unclear, a referral to audiology follows for detailed testing. The screening is a safety net, ensuring no child is missed. Early identification means early support. It's a simple step with a huge impact on a child's future. Every baby deserves this chance. Screening is our first bridge from silence to sound. The 136 plan is a global guideline for childhood hearing health. 1. Screen all babies by 1 month old. 3. Diagnose any hearing loss by 3 months. 6. Start intervention by 6 months. This timeline ensures no child slips through the cracks. Early screening, prompt diagnosis, and swift support give children the best chance to develop language and thrive. The plan is a promise to act quickly and decisively. Every day counts for a child's future. Screening is vital, but parents and caregivers are the true experts on their child. Watch for signs. A baby who doesn't startle at loud noises, doesn't turn to voices, or doesn't babble as expected. Toddlers may not use simple words, struggle to follow instructions, or rely on gestures instead of speech. Older children might seem inattentive, need things repeated, or turn up the TV volume. At school they may fall behind or seem withdrawn. Trust your instincts. If something feels off, seek advice. Early action is always better than waiting. You know your child best. Don't hesitate to ask for a hearing check. Your vigilance can change their life. A hearing loss diagnosis can be overwhelming, but today's support and technology are remarkable. Hearing aids are now tiny, digital, and tailored to each child's needs. For severe cases, cochlear implants can provide access to sound by directly stimulating the hearing nerve. Speech and language therapy is essential, helping children make sense of new sounds and develop clear communication. Therapists also guide parents, turning everyday moments into learning opportunities. Sign language, like British Sign Language, is a rich, expressive option. Many families use both sign and spoken language. The key is finding what works best for your child and family. Every child deserves to connect and flourish. Support opens the door to a world of possibilities. The journey from silence to sound is one no family should walk alone. It takes a community. Parents, professionals, teachers, and friends working together. Parents are the first advocates. Trust your instincts and seek help early. Healthcare teams must act swiftly, listen to concerns, and support families with compassion. Teachers can spot early signs and start crucial conversations. Raising awareness breaks down stigma and empowers families to act. Every poster, conversation, and shared story builds a safety net for children. Early detection and intervention unlock a child's potential. We have the power to give every child the gift of connection, learning, and joy. Together, we can ensure every child's future is filled with sound and promise.